You went to bed last night feeling completely fine. No chest pain, no dizziness, no warning signs at all. But here is the uncomfortable truth. While you were asleep, your brain may have been dealing with reduced oxygen flow, not because of disease, not because of medication, but simply because of the exact position your head rested in when you closed your eyes. Listen carefully, because what comes next has nothing to do with diet, nothing to do with exercise, and honestly, it is something most doctors never bring up during routine checkups. Over years of reviewing cardiovascular and neurological research in people in their 60s, 70s, and beyond, one quiet pattern keeps appearing again and again. The way you sleep, the angle of your neck, the direction your body faces, the alignment of your spine, all of it directly shapes how well blood reaches your brain every single night. And here's the part that makes people stop and think. Stroke risk does not spread evenly throughout the day. It spikes sharply in the morning, with about a 49% increase between 6 a.m. and noon, driven by the natural surge in blood pressure after waking. That is not random. And what happens in the hours before that window, how you sleep, whether your body truly recovers overnight, directly influences how vulnerable your system is when that surge arrives. So before you brush this off and say you have slept the same way your whole life, stay with this. Because what you are about to hear is not theory. It is a chain of small habits quietly building pressure night after night. To understand this fully, you need context. When you are younger, in your 20s and 30s, your blood vessels are flexible. They stretch, they adapt, they compensate without you even noticing. You can sleep in awkward positions and your body corrects for it silently. Maybe you wake up with a stiff neck, but that is usually where it ends. But after 60, things change. Arteries begin to stiffen. The smaller vessels feeding your brain lose flexibility. Pressure inside the skull becomes more sensitive to body position. And your blood pressure regulation system, the one that keeps everything balanced, slows down, especially at night. There is something called overnight blood pressure dipping. In healthy sleep, blood pressure naturally drops by 10 to 20%. This is protective. This is recovery. But if your sleep position is wrong, if it compresses certain vessels, restricts breathing, or alters blood flow direction, that protective drop gets disrupted. And when that protection disappears, something far less forgiving takes its place. That is the framework you need to carry forward. Because once you understand this, everything else begins to make sense. Now, the first mistake, and it sounds harmless, sleeping completely flat, no pillow or just a very thin one, body fully horizontal, spine supposedly aligned. It sounds ideal. In fact, many sources even recommend it. But what they do not tell you is what happens inside the body after 60. Without gravity assisting circulation, blood distribution changes. Cerebrospinal fluid, the fluid surrounding your brain, can begin to pool. Intracranial pressure slowly rises. Those already delicate vessels in your brain are now under slightly increased pressure, not for minutes, but for 7 to 8 hours straight. A study in the Journal of Clinical Sleep Medicine found that even a small elevation, around 15 degrees, improved pressure levels and nighttime blood flow. But most people miss the signal. They wake up at 3 a.m. with a dull headache, maybe behind the eyes, maybe at the base of the skull. They assume it is just aging. Drink some water, maybe take medication, then go back to sleep. But what if that headache is not random at all? What if it is your brain quietly telling you the pressure has been too high for hours? The fix is simple. A slight elevation, about 15 degrees, nothing extreme, but enough to shift the balance back in your favor. And yet, that is only the beginning, because the next mistake is even more subtle and far more damaging over time. The second mistake is one that surprises almost everyone: sleeping on your stomach. At first glance, it seems harmless. You are not pressing directly on your heart. Your lungs are not obviously restricted. It feels simple, natural even. But the real issue is not your chest, it is your neck. Because when you lie face down, you cannot breathe straight into the mattress. So your head turns to one side, and not just briefly. It stays there for 7, 8, sometimes 9 hours. Night after night, usually the same side, because the body builds habits. Now think about that position. Your neck is rotated close to 90 degrees for hours. Along your neck run two critical arteries, the vertebral arteries, carrying blood directly to the brainstem, the cerebellum, the centers responsible for balance, breathing, coordination. When your neck stays twisted like that for so long, those arteries can become partially compressed, not fully blocked, but restricted, like a garden hose being stepped on. And here is the problem. Reduced flow for one night might not matter, but reduced flow every night for years. That is not something the body simply ignores. Research in manipulative and physiological therapeutics confirmed that extreme neck rotation measurably reduces blood flow velocity in these arteries. The effect is real, and it builds silently. At the same time, your ribcage presses into the mattress. Every breath becomes slightly restricted. Your diaphragm cannot fully expand. You never reach full lung capacity. Oxygen intake drops just a little, but consistently. So now you have two things happening together. Reduced oxygen, restricted blood flow, both aimed at the most sensitive parts of your brain. For a younger body, compensation hides the damage. But after 60, especially with hypertension or cardiovascular strain, this becomes a slow, cumulative burden. The third mistake looks like the opposite, but leads to a similar outcome. Stacking multiple pillows. 2, 3, sometimes even 4 pillows under the head. People do this for comfort, for reflux, for breathing. And yes, a slight elevation can help. But too much changes everything. Your head gets pushed forward. Your chin drops toward your chest. This creates what clinicians call cervical flexion, and that position compresses the same vertebral arteries, this time from the front. But there is another structure involved, the internal jugular vein. This is the main drainage pathway for your brain, carrying used blood back toward the heart. When your neck bends too far forward, that drainage slows down. Blood does not exit the brain efficiently. Pressure builds gradually. Waste clearance becomes less effective overnight, and the next morning you feel it. Brain fog, heaviness behind the eyes, that strange fatigue after a full night of sleep. It is not laziness. It may be that your brain never fully cleared itself. The correction is surprisingly simple. One pillow, properly shaped, supporting the natural curve of your neck, not forcing it forward. Now, the fourth mistake takes us into something most people never consider. Sleeping on the right side, especially with cardiovascular history. Side sleeping is generally good, but direction matters more than people think. Your heart sits slightly to the left. When you lie on your right side, gravity shifts its position subtly. But more importantly, body weight compresses the right side of your torso. And running through that region is the inferior vena cava, one of the largest veins in the body. Its job is to return blood from the lower body back to the heart. When compressed, that return flow slows down. Your heart now has to work harder to fill properly. For a healthy person, this is manageable. But for someone over 60 with elevated blood pressure or early heart dysfunction, this added strain night after night is not insignificant. It is like running an engine slightly harder every single night. Not enough to fail immediately, but enough to wear it down over time. Studies in the European Journal of Heart Failure even observed that patients instinctively avoided sleeping on the right side. Their bodies sensed the discomfort before their minds understood why. The fifth mistake feels comforting, familiar, almost protective. Sleeping in a tightly curled fetal position, knees pulled up, shoulders rounded, chin tucked down. It feels warm, safe. But physiologically, 3 problems happen at once. First, the lungs are compressed. Breathing becomes shallow. Oxygen levels dip slightly with every breath. Over an entire night, that reduction adds up. Second, blood vessels in the hips and behind the knees become partially compressed. Circulation in the lower limbs decreases. If swelling or poor circulation already exists, this position worsens it. Third, the neck bends forward again. The same compression pattern returns. Blood flow into the brain decreases. Drainage out of the brain slows down. Research in respiratory physiology showed that sustained spinal flexion reduces tidal volume by around 10%. That may sound small, but across an 8-hour night, it represents a significant drop in oxygen delivery to brain tissue that is already aging. Now, the final mistake in this group ties everything together. late eating, and alcohol before bed. This is one of the most common habits. Dinner around 7:30, maybe a drink. Bed by 10. It feels normal. Routine. But internally, your body is still working. After a large meal, blood is redirected toward digestion. Less is available for the brain and heart. In younger bodies, this shift is smooth. In older bodies, it can create brief drops in brain blood flow. Then alcohol adds another layer. It relaxes blood vessels, lowering pressure. The body reacts by tightening them again. Pressure rises, then falls, then rises again. A cycle throughout the night. This constant fluctuation stresses the vessel walls, especially if they are already stiff or fragile. Studies in the American Journal of Hypertension found that even moderate alcohol within 3 hours of sleep disrupts the natural nighttime blood pressure drop. And without that drop, cardiovascular strain increases. Sometimes this shows up as waking suddenly at night. Heart racing, slight sweating. You think it was a dream, but in reality, your body may have been trying to stabilize itself. Small habit, big impact. And now, after all these hidden risks, it is time to look at what your body actually needs. After everything you have just heard, one question becomes unavoidable. If so many common habits are quietly working against you, then what actually works in your favor? The first answer is clear: sleeping on your left side. This is not just a preference. It is one of the most consistently supported positions for both cardiovascular and neurological health in adults over 60. When you lie on your left side, gravity aligns more naturally with the position of your heart. The inferior vena cava, the major vein returning blood from the lower body, runs along the right side of your spine. So when you shift to the left, that compression disappears. Blood returns to the heart more freely. Circulation stabilizes. The heart does not have to strain just to fill properly. But here's where it becomes even more important. About a decade ago, researchers identified something called the glymphatic system. Think of it as your brain's cleaning system that only works efficiently while you sleep. During the night, cerebrospinal fluid moves through the spaces between brain cells, flushing out metabolic waste, including proteins like amyloid beta and tau, the same substances found in excessive amounts in Alzheimer's disease. And this process is not equal in every position. A study published in the Journal of Neuroscience found that this clearance system works most efficiently when you sleep on your side. And more specifically, the left side appears to offer slightly better drainage due to the natural asymmetry of the brain and the direction of fluid flow. That means this is not just about better sleep tonight. It is about whether your brain is clearing harmful buildup that accumulates slowly over years, even decades. If you are not used to sleeping on your side, the transition does not have to be difficult. A full-length body pillow can support your front and prevent you from rolling. A pillow between your knees keeps your spine neutral. Give it time. The body adapts faster than you think. Now, what if side sleeping is not an option? Joint pain, shoulder discomfort, or simply decades of habit can make it difficult. There is a second position, and when done correctly, it is highly effective. Sleeping on your back, but with elevation. Not just stacking pillows under your head. That creates the same problems you heard earlier. The key is lifting the entire upper body at a gentle incline, around 15 to 30 degrees. This can be done with a wedge pillow or an adjustable bed. The goal is a smooth, gradual elevation from the waist up. What does this achieve? It allows gravity to assist blood returning from the lower body. It reduces the pooling effect that increases pressure inside the skull when lying flat. It helps keep the airway open, improving oxygen flow throughout the night. And if you place a small pillow under your knees, you create what researchers call a zero-gravity posture. Weight is distributed evenly. No single joint or vessel carries excessive strain. This position is especially helpful if you deal with sleep apnea, morning headaches, swollen legs, or blood pressure that remains high overnight. But position alone is not the full story. Your sleep environment matters just as much. Temperature is critical. A cooler room, around 65 to 68 degrees Fahrenheit, helps your core temperature drop. That drop is the signal for deep, restorative sleep. And deep sleep is when real cardiovascular recovery happens. Too warm, and your heart rate stays elevated, keeping you in lighter sleep stages where recovery never fully occurs. Light exposure matters too. Blue light from screens after 9 p.m. suppresses melatonin, delaying deep sleep. And without deep sleep, the brain's cleaning system slows down. Noise, even subtle noise, can trigger micro-awakenings. You may not remember them, but your body does. Each one causes a brief spike in heart rate and stress hormones. And there is one simple tool worth mentioning: an overnight pulse oximeter, a small device that clips onto your finger and tracks oxygen levels while you sleep. If your oxygen repeatedly drops below 92%, it may signal sleep apnea or circulation issues, both of which increase stroke risk significantly. This is not guesswork. This is measurable. Now step back for a moment and look at the bigger picture. Your risk does not disappear when you fall asleep. In many ways, the hours between midnight and dawn are the most critical part of your entire cardiovascular cycle. And the position you choose during those hours is something you can control immediately. No cost, no prescription, no waiting. You do not need to change everything at once. Pick one change. Sleep on your left side tonight. Elevate your upper body 15 degrees. Stop eating 3 hours before bed. Replace multiple pillows with one properly shaped pillow. Each one may seem small, but repeated every night, they compound into something powerful over time. So now the question is simple. What will you change first? If this helped you see something you had never considered before, share your thoughts. Let others know what you are trying. And if you found value in this, support it so more people can learn what their bodies have been quietly trying to tell them. Sleep smarter. Protect your brain. Take care of yourself.